Calamity.
Welcome to another episode of The Breakdown. I'm your host, Nate Pike, and on this episode, we are here to talk about one thing only. The saga around the $80 million of taxpayers' money spent on children's medication continues to evolve, and a statement of claim from the former AHS CEO sees the procurement of the medication playing a central role in alleged concerns around the procurement process that saw Albertans only receive a fraction of the medication that they paid for, with almost $50 million apparently still in limbo. And while that situation has exploded into what the NDP have named the corrupt care scandal, there's some basic foundational questions that we've continued to pursue answers on, despite being the target of a $6 million lawsuit from Sam Mraiche and his company MH Care Medical. That lawsuit remains ongoing. Tonight, though, we wanted to talk about another piece of the puzzle that has fallen into place via a FOIP request that we recently received the results of. But in order to explain the context of that FOIP, let's go back to the fall of 2022 when the procurement of the children's medication hit the news. On December 1st, 2022, then Health Minister Jason Copping issued this directive. Pursuant to Sections 8 and 16B of the Regional Health Authorities Act, I, Jason Copping, Minister of Health, direct as follows. Alberta Health Services, AHS, shall take all necessary steps to procure on an expedited basis the following pharmaceuticals impacted by national shortages: acetaminophen oral liquid 80 milligrams per milliliter or 32 milligrams per milliliter, ibuprofen oral liquid 40 milligrams per milliliter. AHS will ensure the procurement complies with the applicable Health Canada requirements. Alberta Health will ensure the funding for all costs related to the procurement, including shipping and distribution costs, will be provided to AHS. AHS and its agents will be authorized to distribute and sell the product to pharmacies and other provinces with the intent to recover as much of the costs as possible. This is the directive that ordered the purchase of the children's medication by AHS. And while there's definitely a conversation to be had about this being a perfect example of why there has historically been a firewall between elected officials and the implementation of healthcare, that's a conversation for another day. Today, we're here to talk about a few specific things. And we want to start with the fact that then Health Minister Jason Copping went out of his way to specify what concentrations of the medication to order. He's very clear. Acetaminophen, the generic chemical name for the active compound in Tylenol, 80 milligrams per milliliter or 32 milligrams per milliliter, and ibuprofen at 40 milligrams per milliliter. 80 milligrams per milliliter is the concentration typically used for infants under the age of 2 years old. It's a stronger concentration because babies don't generally like to take in a lot of anything when they're sick. 32 milligrams per milliliter is the dose for kids above 2 years because they can generally follow instructions a bit better than a baby. And when you have kids whose hands can do hand things, having a lower concentration around is generally a good thing. Because if kids get into acetaminophen for just, the fun grape flavor, it can be really damaging to their livers. For the ibuprofen, the concentration that was mandated by the directive, 40 milligrams per milliliter, is generally the dose used for kids from 4 months to 2 years. The higher concentration being, again, because infants generally tolerate smaller volumes of liquid better. So, to be clear, the ministerial order issued was directing AHS to purchase acetaminophen in the exact same concentrations that are currently used in North America, commonly under the Tylenol brand name. There's many other providers of acetaminophen, but let's be clear. None of the other providers or brands other than Tylenol are Tylenol. They're just not. They're Tylenol, but not. Tylenol not. Where things got really confusing, though, is when it comes to what AHS actually ordered. Because according to this purchase order, issued on December 9th, 8 days after the initial ministerial directive was issued, what was actually ordered was acetaminophen with a concentration of 24 milligrams per milliliter and ibuprofen with a concentration of 20 milligrams per milliliter. Now, to be very clear, both of these concentrations are lower concentrations than were actually ordered by the health minister to be procured. These lower concentrations also arguably make the medication slightly safer to the risk of overdose and organ damage, but the lower doses also make it easier for parents and caregivers to give not enough of the medication for it to do what it needs to do if they're used to using the normal concentrations found in North America, which made us wonder why. When the ministerial directive was issued that clearly spelled out the exact concentrations to be ordered, why would AHS then go ahead and spend $70 million of taxpayers' money on not those exact concentrations? So as we do on this show, we filed a FOIP. And in that FOIP, we explicitly asked, seeking all records as defined by Section 1Q of the Act related to any communications authorizing or related to the change of concentrations of the Atabay children's medication ordered on December 9th, 2022 from the original concentration mandated in the Ministerial Directive of December 1st, 2022 of acetaminophen 80 milligrams per milliliter or 32 milligrams per milliliter to the ordered concentration of 24 milligrams per milliliter. Please include any relevant correspondence directing this change or any approvals of the change, which is a pretty complete and specific request. On May 9th, we received the results. We did not receive any correspondence suggesting that any records had been withheld. And that's what we're here to talk about tonight. On December 1st, 2022, a Thursday, an email was sent out that appears to reference a draft version of the ministerial directive. There was a flurry of discussion as to various timelines. Subject, forward, pediatric analgesic announcement. FYI, I just received this draft NR from the DMO. They are also under the impression this would be Monday at the earliest. Please don't share further. On December 5th, the Monday after the weekend, Isaac Van Dyne, who was then the director for the Office of the President and CEO, asked for an update. Subject, regarding pediatric analgesic announcement. Importance high. Hi, JP. The minister's office is just asking for an update on the pediatric acetaminophen procurement. Are you able to get us something as soon as possible this morning? And this is where we start to get some answers and some more questions, because shortly after, a reply was sent by Jatender Prasad. Hi, Isaac. Update as of this morning is as follows. The manufacturer has applied to Health Canada for approval over the weekend for 2 strengths of acetaminophen and 1 strength of ibuprofen suspension. Health Canada has confirmed that they have received the applications that are in the process of reviewing. They have not provided any preliminary feedback at this time. The application number is noted below. The 2 strengths of acetaminophen that they have applied for our approval are 24 milligrams per milliliter and 32 milligrams per milliliter. The reason for the 2 strengths is that the 24 milligrams per milliliter strength is what is predominantly sold in the international markets, and the export manufacturer has export authorization from the Turkish regulators, so it can be received in Canada faster. This strength is the same as what Health Canada has imported from Australia. They will switch to the 32 milligrams per milliliter once approval is received. If approvals are received in a timely manner, the first flight can land in Alberta December 15th or 16th. The product will have bilingual labeling. Purchase orders will be provided once we hear back from Health Canada on their preliminary assessments. Product will have an expiry of more than 24 months. Thanks, Isaac. So just 4 days after the ministerial order was issued, and over a weekend no less, an individual named Jatender Prasad appears to be a person managing the procurement of the children's medications. And it clearly shows the procurement will not adhere to the concentrations set out in the ministerial directive, and that a decision was made to go with the lower concentrations as it was already available. The reply references the fact that Health Canada had procured the same concentration from Australia. What appears to be left out from this email, though, is the fact that the Australian product imported to Canada was only for use in hospitals under strict safety precautions, and it was never available for public sale. In this response, Mr. Prasad indicates there would be a switch to the standard North American concentration at some point in the future, but that part of the plan certainly never carried over to the purchase order that was issued to MH Care. So even though there was no identified shortage in the hospital supply chain, the first part of the order was a supply that could only be used in hospitals. And the supply that was ultimately ordered on the PO in no way reflected that pivot in concentrations in any way. And in the original PO, the delivery date was specified as being December 14th, 2022. But adding even more confusion is this exchange on January 10th, 2023, which came at a press conference more than a month after the initial announcement.
We have a statement from Health Canada that says they received proposals by Alberta for the importation of children's ibuprofen and acetaminophen for use in pharmacies, and that a decision was provided to you guys in December. What exactly did that decision say?
There's a couple of things that we had to do in working through with a new supplier. The Health Canada has to go through and examine the manufacturer. They have to examine our import facilities. We had to make sure that the formulation was the same as we would sell for generic products here. We had to get French and English packaging approved. And we went through all of those different steps. And so as a result, we have our first shipment arriving on the weekend. It's going to be for Alberta Health Services use. It's 250,000 bottles. The remaining 4.750 bottles is 4.750 million bottles are going to be subject to an additional delay because for retail use, you have to have a child-proof cap. As I understand it, we are working on making sure that that approval process is taking place, and so that'll be the second batch. And as soon as we know when the retail use is going to be available, we'll do another press release. But the good news is that our Alberta Health Services hospitals will have the first shipment by this weekend.
Well, I'm talking specifically about pharmacies. So those are supposed to be on the shelves by Christmas is what you guys said. They aren't on the shelves. So I'm just wondering, so how I understand it is that it was actually rejected, that proposal in December, and then you had to put forward a new proposal. Is that correct?
No, it was just a process we went through. I mean, we respect Health Canada has a role in making sure that we have the safest product possible on the shelf. And the issue that they had was that when you make a product available for a retail use, it has to have a child-proof cap. So we're just working with the manufacturer to make sure that that is in place so that we can make it available for retail use. And look, I don't want to rush Health Canada. Certainly want to make sure that people, as soon as the supply arrives, that they feel confident in it. It really was just a matter of us meeting the regulatory conditions, and that was the last condition we needed to meet.
So you had to put forward a new application.
We've been working with them right from the beginning. We always knew that we would have a certain amount that would arrive that would be for AHS use, and then we had to continue working with them to make sure that we had the bottling that met their specifications. One of the specifications was we had to make sure that it was listed in the same familiar type of formulation that we have in Canada. We had to make sure French and English labeling, and this last hurdle is we just have to make sure we've got the child-proof cap. So it's been a process that we've been going on. It's just taken a little bit longer than we expected, but the first shipment is arriving this weekend for Alberta Health Services.
Just to confirm, this is the same application that came back in December.
I've been working with this on this all the way along. We have been working with Alberta Health, Health Canada to make sure that we were meeting all of their compliance. It's a brand new supplier. There's just a couple of hurdles that we needed to get through, and we're almost on the last one.
So, according to the Premier herself, Health Canada approval had not yet been granted. The safety requirements for the bottles had not yet been met, but nonetheless, the purchase order had been issued on December 8th, 2022. It wasn't until January 18th, 2023, more than a month after the December 14th delivery date stipulated in the PO had passed, that the first shipment arrived and was directed to hospitals because that product did not meet the safety standards for retail sales. From the Alberta government's own press release. In order to receive Health Canada approval, the manufacturer was required to submit a proposal outlining information on the medicine's quality, safety, and product packaging. Health Canada reviewed the proposal and requested additional information as well as a number of changes to meet Canada's regulatory requirements. One of these changes was the need to add child-resistant caps to the bottles for retail use supply. In the interim, An initial shipment was approved for hospital use only, as child-resistant caps are not a regulatory requirement when medicine is administered by medical professionals in a hospital. As a result, rather than wait for the total shipment, Alberta's government opted to receive a first shipment with medicines for hospital use. And we know from our previous FOIP that the first payments had been made on December 9th, 2022. Clearly, before the medication was even approved for either hospital use or for retail sales. In fact, the exact dates for the approvals as per the Health Canada website are December 30th, 2022, January 26th, 2023, and February 10th, 2023. So there are a lot of unanswered questions still, perhaps even more than we started with. But it seems we have some indication towards an answer to one of our biggest questions, and that is who managed the procurement of the meds and who seems to have overridden the minister's directions. And based off of these FOIP results, we can say that Jatender Prasad appears to have been the lead in the procurement process. Some of you might find that name familiar. Let's quickly reference another pertinent document, and that's the statement of claim by former Alberta Health Services CEO Athana Menzalopoulos, whose allegations remain to be tested in a court of law. Because in paragraph 20, section A, she alleges that Prasad retired briefly from AHS in April 2022 before becoming a contractor for AHS, and then returned as an AHS employee in the position of Chief Program Officer and later Special Advisor for AHS Contracts, Procurement, and Supply Management from October of 2022 to December of 2023, before then being seconded from AHS to Alberta Health. And in section B, she alleges Prasad had an MHCare medical email address, jprasad@mhcaremedical.com, in November 2022, just before the then Minister of Health directed AHS to enter in a contract with MHCare for a $70 million children's acetaminophen purchase order and supply agreement. Further, in paragraph 41 of the CEO's statement of claim, she states, in October 2024, AHS also received a media inquiry regarding the AHS purchase of children's ibuprofen and acetaminophen that included questions about any business AHS had with MHCare Medical and any other companies owned by Sam Mraiche. The media inquiry was sent to Prasad to draft a reply because Menzalopoulos had been told by Alberta Health that Prasad was the person who negotiated the AHS purchase contract for children's acetaminophen and knew everything about the deal. So to be clear, the lawsuit launched back in February of 2025 by the former AHS CEO alleged that Jatender Prasad was not only the individual that negotiated the deal, but also alleges that he had an email address with the company that was tasked to bring in the medication over a 4-day period, including a weekend. Additionally, in a February 20th, 2025 article in the Globe and Mail, emails obtained by the Globe show that on January 11th, 2023, Mr. Prasad forwarded an email from an MHCare account in his name to what appears to be his personal Gmail account, then to his AHS account. He then forwarded that email, which included the resume of another person with an MHCare email, to an AHS employee who worked in procurement. The original forwarded email was dated November 7th, 2022. This report by the Globe seems to strongly suggest that Jatender Prasad indeed had access to, if not control of, an MHCare email account between November 7th, 2022 and January 11th, 2023, when the medication order was negotiated and placed. The allegations in the former CEO's statement of claim, as of yet untested in a court of law, and the results of this FOIP read together seem to clearly show that Jatender Prasad was indeed the point man on the deal while having some sort of a relationship with MHCare that necessitated him having a corporate email with them. Now, we did reach out to MHCare and ask them for comment. They declined. We also attempted to email the jprasad at MHCare Medical email address for comment, and while we didn't receive a reply, we also didn't get any notifications that you would expect to get if you sent an email to an inactive or incorrect address. Do with that what you will. And this brings us to the point. There are problems here. That is undeniable. The need for an independent judicial inquiry enacted under the Inquiries Act should be a foregone conclusion at this point. But for reasons defying reason, the Premier of Alberta, Danielle Smith, continues to refuse to put that inquiry into motion. And this is why the AHS CEO's lawsuit should be so important to Albertans. Because now, with this FOIP, we can say at least one of the things that she alleges in her lawsuit appears to be true. Specifically, that Mr. Prasad was involved with negotiating the purchase contract for the children's acetaminophen. And if this piece is true, Albertans deserve to definitively know if Jatender Prasad did or still does have an email address with MHCare, and they deserve to definitively know whether or not any of the other allegations in the former CEO's lawsuit are true. And there are a lot of allegations in that lawsuit that suggest corruption at the highest levels of government in Alberta. Albertans deserve to know why the Premier, Danielle Smith, whose own office, cabinet, and her own damn self are directly tied to the principals in the allegations, why she refuses to provide Albertans the transparency they deserve, and that only a truly independent inquiry under the Public Inquiries Act can deliver. But again, instead of holding a public inquiry that could compel testimony and force the truth into the light, Danielle Smith, her ministers, and her MLAs refuse to make that happen. Instead, the government seems hell-bent on utilizing massive legal resources paid for by the taxpayers of Alberta to exhaust the resources of that former AHS CEO to prevent her lawsuit from ever seeing the inside of a courtroom. And in the absence of a public inquiry, that lawsuit remains the best option to ensure that Albertans get the truth. Here at The Breakdown, we're going to continue to pursue this story and the truth despite the ongoing $6 million lawsuit against us by MHCare and Sam Mraiche. If you want to help us in that fight, you can do that at www.savethebreakdownab.ca. If you want to help the former AHS CEO Athana Menzalopoulos continue her lawsuit against the government of Alberta, which is again currently the best hope at the full truth ever seeing the light of day, you can do that at the GoFundMe set up by folks from Danielle Smith's own constituency at saveathana.com. To be extra clear, those two campaigns are completely unrelated. We'll be back next week with another one of our regular roundups. But in the meantime, as always, take care of each other and keep the conversation going.
How's your BS detector evolved over time?
I tend to be pretty trusting.